So developmental and behavioral conditions are quite common in children, and developmental pediatricians are physicians who have specialized training in developmental disorders and behavioral conditions. However, relative to the number of children who could benefit from seeing a developmental pediatrician, the number of developmental pediatricians is relatively few. This has the potential to limit access to rigorous diagnostic evaluations, which in turn can ensure access to specialized services and therapies. Given the workload-workforce mismatch, it's commonly accepted that there's long wait times for developmental pediatric evaluations. That's why we were surprised when we were unable to find any studies that documented what the wait time was nationally. The approach we used was a mystery shopper study. This approach is used commonly in marketing research, but has been less applied in healthcare. In this case, a trained study team member called developmental pediatric programs that are affiliated with U.S. children's hospitals to request an appointment for his simulated son. Given that individuals with limited English proficiency often have difficulty navigating the healthcare system, we were especially interested to see whether there would be differences when we called in English versus if we called in Spanish. If programs gave us an estimate on wait times in English, we then called them within 24 hours in Spanish to see what the response would be. As we expected, we identified long wait times for developmental pediatric evaluations nationally. We were surprised at the number of programs that did not provide an estimate when we called in Spanish, even though they had just provided an estimate when we had called in English. We were also surprised at the number of programs without language accommodations at the time of our call. So for clinicians, I think our findings serve as a reminder that there can be long wait times for these assessments, and the importance of making concurrent referrals to therapies and services to ensure children are supported in a timely way. Our findings also serve as a reminder that families with limited English proficiency may require additional support in navigating this process. For researchers and policymakers, I think our findings emphasize the importance of evaluating different care models that leverage the strengths of professionals to ensure that children with developmental concerns reach the right providers at the right time.